Gallstones can lead to various complications, some of which can be serious and require medical attention. Here are some of the potential complications associated with gallstones. Cholecystitis. This is inflammation of the gallbladder, often caused by gallstones blocking the ducts that drain bile from the gallbladder. Cholecystitis can lead to severe abdominal pain, fever, nausea, vomiting, and potentially life-threatening complications if left untreated. Gallstones can sometimes move from the gallbladder into the common bile duct, leading to a blockage. This condition is known as cholelithiasis and can cause symptoms such as jaundice, yellowing of the skin and eyes, abdominal pain, fever, and potentially pancreatitis. Pancreatitis. In some cases, gallstones can block the pancreatic duct, leading to inflammation of the pancreas known as pancreatitis. This condition is characterized by severe abdominal pain, nausea, vomiting, fever, and can be life-threatening if not treated promptly. Gallbladder cancer. Although rare, long-standing inflammation of the gallbladder, such as that caused by gallstones, can increase the risk of developing gallbladder cancer. Gallstone pancreatitis. Sometimes, gallstones can block the pancreatic duct, causing inflammation of the pancreas, a condition known as gallstone pancreatitis. This can lead to severe abdominal pain, nausea, and vomiting, and can be life-threatening if not promptly treated. Visit Prof. Zahid Mahmood for best treatment at Hameed Latif Hospital, Garden Town, Lahore.